I think it's very normal and it's natural for patients to have questions and to want to feel like you really understand and that they fully understand the treatment plan, but it
Yeah.
really can put them into a sort of rabbit hole where you're kind of
Right.
getting way off track and it's going to create more problems than it solves. What I do find is helpful is the pre-handling aspect of it. So making sure that as
Okay.
you're explaining your treatment plan, you're asking certain questions as far as what timeline are you looking to get this done in? What is the most important aspect of everything we talked about? What's the one thing you want to see first? If it's about, asking if they have a certain budget they're trying to stay within, asking if they've explored financing options, asking about what their support system looks like, if their spouse knows if they're here with you already today. When they start asking all these questions, you can refer back to that information, and it does help because you can say, well, like we discussed earlier, I know you said your husband's really supportive of this, and that helps with the objections, but also helps you circle back when they start going down this list of, I know that your timeline is December, end of the year. You're asking how long the results are going to be. We discussed it's going to take at least 6 months to get the peak collagen stimulation.
Yeah.
And you use that pre-handling for objections, but also for kind of circling back on the questions. So what I told this patient, because towards the end, we were just like, 5, 10, 15 minutes. I was really running behind in clinic. And so I told her, I was like, hey, I don't want to make you feel like you're rushed. I want to make sure that all of your questions are answered. Here's what I'm going to do. I'm going to type out your treatment plan for you. I'm going to type out how I would pace it out, the pricing for each option, what your priorities are, and how I would propose pacing this out for you. From there, we
Mhm.
can then schedule a call. We'll schedule for about 15 minutes. Setting the timeline is really, really important, where we can go over
Okay.
any additional questions you have. That way, you have time to go over it with your husband. You have time to look into your financing options, and we can kind of go from there. And that really helps just restructure and get the control back. So that way, you're not just circling and circling and circling.